New candidates are అందుకనే. Hello, everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own tumor master, Dr. Krishnamani, to spread awareness about cancer and to help patients and caregivers access the right treatment at the right time. When we think about cancer risk, we often associate it with age, but in some families, genetics can dramatically change that timeline. In today's session, when genetic outruns age, Li-Fraumeni syndrome, which is a rare inherited condition that significantly increases the risk of developing multiple cancers, often at a very young age. It is caused most commonly by mutations. This syndrome highlights the powerful role that genetics can play in shaping the cancer risk, sometimes long before we expect it. To explain this topic to us today, we are going to have with us Dr. Krishnamani, a highly respected leader in the field of oncology. For over a decade, he has been associated with AOI hospitals here in Hyderabad. He has been at the forefront of cancer care, bringing deep expertise in the management of solid tumors, hematological malignancies, and oncological emergencies. His professional journey includes prestigious international fellowships and key leadership roles across some of India's leading cancer centers, reflecting a truly global outlook combined with strong clinical excellence. Beyond patient care, he has played an important role in advancing oncology practice, contributing to treatment protocols, supporting research initiatives, and helping shape cancer care frameworks. What truly distinguishes him, however, is his compassionate, patient first philosophy. To his patients and their families, he is not only an exceptional oncologist, but also a reassuring guide through one of life's most challenging journeys. We're glad to have you with us today, sir.
Hello and welcome to Cancer Reach. Thank you. Cancer Reach is an initiative to spread awareness on cancer. And today we have chosen a topic which is of academic interest and also of an interest to our patients and their caregivers. It's an offbeat topic, which is called the Li-Fraumeni syndrome or P53 mutation syndrome.
Sir, can you begin by explaining what exactly is Li-Fraumeni syndrome?
See, what we should understand basically is cancer. What is cancer or a tumor? It is an overgrowth of cells because of no inhibition or no stoppage. Okay. So in the body, there are checks and balances. If there is something required to grow a cell, there is also something required to prevent the growth of the cell, because of which there is always a constant balance. So when cells are produced, cells die. Otherwise, if cells are only produced, then you develop cancer. If cells are dead or only dying, then obviously the human body dies. So this is called a cell cycle. In the cell cycle, there is production of cells and destruction of the cells. So there are promoting factors, there are down regulating factors, and this balance is always maintained. So in this cell cycle, there is something called a oncogene and a tumor suppressor gene. When your oncogene becomes high, you develop cancer. Tumor suppressor, what does it mean? It suppresses your tumor. When tumor suppressor becomes low, tumor suppressor gene is low. That means tumor is not getting suppressed. Tumor will start growing. So there are certain oncogene mutations. If mutations happen in an oncogene or mutations happen in a tumor suppressor gene, you develop cancer. One such mutation is the P53 mutation, which is seen on chromosomal 17. That mutation leads to this Li-Fraumeni syndrome. So Li-Fraumeni syndrome is due to a genetic mutation on chromosome 17 in a gene called P53, which is called a tumor suppressor gene. In fact, in medical language, P53 is called the guardian of the genome. It protects the genome. So it is the father figure, the guardian. So when the P53 is knocked out, you develop tumors. And those people in whom it is germline, that is, it is inherited, they develop Li-Fraumeni syndrome. And in this Li-Fraumeni syndrome, because there is no P53, they develop all kinds of cancers from brain tumors, from adrenal cortical tumors, eye tumors, skin tumors, breast tumors, sarcomas, so on and so forth. Mm.
Sir, at what age are patients exposed to this gene mutation?
So, first you should know what is the incidence of this. The incidence of this, or how common is this? 1 in 5,000 to 1 in 20,000 people can develop this, number one. It is seen even in the pediatric age group. And these patients are exposed to tumors from any particular age. They are exposed to various types of skin soft tissue sarcomas, osteosarcomas, eye tumors, at later life lung bronchoalveolar carcinomas or breast tumors or adenocortical tumors, brain tumors, etc.
Sir, is there any specific gender predilection for this syndrome? Either males or females are more affected.
Both are equally affected. If a female has this genetic mutation, 100% of times in her lifetime, she may develop cancer. In men, the chance of developing cancer with this mutation is 75% or 80%. So it means a very high number of people who have this genetic mutation will develop cancer. All women will develop, most men will develop, three-fourths of men.
Sir, what are the typical signs and symptoms that are associated with the syndrome?
So understand, even if there is a medical student listening today, what you should understand is Li-Fraumeni syndrome is a constellation of cancers, can lead to brain tumors, can lead to choroid plexus carcinomas in the eye, can lead to skin tumors, can lead to lung tumors, can lead to breast cancers, usually in premenopausal women, can lead to adrenocortical tumors, which lead to pheochromocytoma. We discussed that in the last time, that can lead to hypertension and all that. So symptoms will be related to these cancers, sarcomas. If you have a sarcoma, you will present with a painless lump. If it is in the bone, a lump in the bone or a swelling in the bone with a limp or with a fracture. If you have brain tumors, you are going to present with headache. You're going to present with seizures. You're going to present with weakness of a limb. If you have a breast tumor, you're going to present with a breast lump. So these are all the symptoms. And if you have these kind of two, three different kinds of cancer symptoms in cancer involvement in you, or if you have this cancer and very close first or second degree people in a very young age below 40 or 45 have developed different types of cancer, it means most likely you guys all have Li-Fraumeni syndrome and you need to be evaluated for that. So what we should understand is variety of cancers, young people below 45 and multiple family members affected.
Sir, is there any specific test to diagnose this particular
Correct. So
syndrome?
you're going to test it with the germline testing of the P53 gene. So you're going to do the blood test, and in that, if the P53 is mutant, that means we have Li-Fraumeni syndrome.
Sir, is there any screening or surveillance which is available for this syndrome? Any protocols?
Yeah, so I told you there are tens of different types of cancers from head to toe. So your screening will begin at a very, very early age, even maybe in the pediatric age group, or as early as the ages of 18 years. Okay. Whole body MRIs every year are generally recommended to look for brain tumors and all that. If you're looking at the breast ultrasounds are recommended. For abdominal CTs are recommended, or abdominal MRIs. One thing in Li-Fraumeni syndrome is because there is a radiation risk, you don't try to do CT scans that often or X-rays that often. Ultrasounds or MRIs are preferred because you're going to do screening at every yearly interval. And how long will the screening continue? The screening will continue for almost up to the ages of 60 or 70 also. Because the lifetime risk of developing cancer remains till the ages of 65, 70 also.
And sir, like the screening protocol is supposed to be followed by all members of that one particular family, like the first generation, second generation, third generation, and so on. All the
All
members.
of them who have the mutation.
Okay. Okay. Sir, once it is detected, how do you after the diagnosis, how is the patient categorized for the treatments? What are the treatment options which are available?
Treatment is the same like those who do not have the genetic mutation. In case you have a breast lump, what are you going to do? You are going to do a evaluation. You are going to do hormonal status, HER2 status, surgery, or chemo, or hormonal therapy or trastuzumab based therapy, everything. So same way, if you are going to have a brain tumor, which is a big brain tumor or which is symptomatic, you're going to remove the brain tumor and then think of giving radiation to the brain. So that is the way if it is a sarcoma, you're going to treat it with surgery and if required chemotherapy. So treatment is always similar to the way you treat the tumors in the general population.
Sir, are there any particular targeted therapies which are available for this particular mutation?
As far as I know, no. As far as my knowledge goes, there is nothing specifically targeting. Yes, there is a lot of research going on to target the P53 mutation, but right now you don't have any specific medication. So the emphasis is on identifying the patients who probably are carriers, screen the affected members also, and offer proper surveillance and treat when they are diagnosed.
Sir, what is the prognosis of this syndrome?
So the prognosis is so the treatment is similar to how you treat, and the prognosis is more or less similar. But the chance of these patients developing other cancers is high. That will determine the prognosis. The chances of these people, most of these people developing cancer in their lifetime is extremely high. So overall, the prognosis is poorer compared to a lay person because the lay person may never have developed cancer in the future. This person may develop not only one but multiple cancers which require treatment. And unfortunately, what happens is post-treatment also, if you give radiation, they may develop skin cancers. So post-therapeutic cancers also they may develop. So that also impacts the prognosis.
Sir, what can you tell us about the quality of life of these patients?
So the quality of life will be good, will be similar. It will be hindered only by few factors that there's always a mental strain that you carry a mutation and you are going to develop multiple cancers. You need to be on regular surveillance. So they need a lot of psychological motivation, counseling, that every year they have to motivate themselves regularly and get these MRIs or scans done. And I've seen patients who come to us, and once the tests are done, it's almost like they have a relief that everything is normal. It's like after they've given an exam, final exam, but again, the tension starts when they're going for their next set of tests after 1 year. So that is what happens. So what we need is a good psycho-oncologist or a psychological counseling, allay their fears, anxiety, keep them under a proper surveillance program, and then otherwise it should be fine.
Sir, is there an option to test for this syndrome prenatally also?
Prenatally, I don't think we do it prenatally. We don't do it prenatally.
Okay, sir. Sir, can you tell us anything about the recent advances in this particular treatment therapy area
So
for Li-Fraumeni?
the recent advances are all about your surveillance, which should start at an extremely young age, the identification of these tumors. So some recent guidelines are any patient presenting with a choroidal carcinoma, any patient present with an embryonal type rhabdomyosarcoma, anaplastic variant, any patient presenting with a young ALL, acute lymphoblastic leukemia, we call it a hypodiploidy variant. A patient presenting with the adenocortical tumor, all these patients, irrespective of their family history, should be evaluated for Li-Fraumeni syndrome. So these are some of the advances. There are clear-cut guidelines, as I discussed, when to start the surveillance. Germline testing is an advance. If somebody has a somatic testing for P53, they should have a germline testing also. Suppose on the tumor they show a P53, do it in the blood also. So these are all the advances.
Sir, you have elaborated that these patients are at an increased risk of cancer. So, do they keep on getting the same cancers again and again, or do they get different type of cancers the
Could
second
be
time?
both. It could be both. You can develop bilateral breast cancers, you can develop breast, brain, cortical tumors, sarcomas. It could be a mix of one after the other.
Sir, what message would you like to share with the families who may be silently carrying this risk without knowing it currently?
So if you in your family or you know someone who's having multiple cancers or multiple members in your family affected with this kind of brain tumors, sarcomas, lung tumors, breast tumors, talk to your oncologist, talk to your physician. You may be suffering from Li-Fraumeni. Get a genetic testing, germline testing done. Test in the unaffected family also so that they can be under surveillance so as not to get the disease or catch the disease early.
So, can you summarize today's session for our viewers?
So Li-Fraumeni, from a genetic standpoint, is a common mutation of the p53 gene, which is the gatekeeper gene or a tumor suppressor gene. Now, because the brakes are released because of the mutation, the tumor starts growing, and these patients develop a host of cancers or tumors, and they should be kept under regular surveillance. If they are kept under regular surveillance, or if these tumors are caught early, they are treated similarly, and then the prognosis is usually good.
So, can you tell us a little bit about the second opinion campaign which you are currently running?
So, as you all know, we have a second opinion campaign on a WhatsApp. You can send in your reports, we'll reply to you. It's free, it is only to guide you, especially for patients who are located at places where they probably don't have cancer access. We try to get back within a day or two. Any reports, put it up. It's only an opinion, it is not a final guideline, but you can discuss with your doctor about it.
Thank you for taking this time out and for enlightening us on today's session, sir. We hope to see you again next Friday with another interesting topic.
Thank
Thank
you
you,
so
sir.
much. Thanks.
Thank you.